Good morning and welcome back to Current Review. We are on the 74th episode. I'm your host, Angel Tekisa, and today, on the 25th of March 2025, we're going to be talking all things states fight against TB. And joining us is MEC Monyatso Mahlatsi. Good morning, Minister. How are you doing?
Good morning, Angel. I'm doing great. I hope you're doing well as well, you and your team.
Yes, we're doing quite well. We understand that you are on the road, and just to get straight into the conversation, we are talking all things tuberculosis effect in the Free State. Can you run us down, give us a rundown of the TB situation in the Free State right now, and how many cases are we having as well as treatments?
Thank you very much, Angel. Let me also pass my regards and greetings to your viewers. We, as a Free State, this is where we stand. But remember, as Free State, we are part of South Africa, which is a country, and we have 270,000 diagnoses, of which 56, we lose about 56,000. In fact, we lost 56,000 people in 2023 alone, according to what the Deputy President spoke about yesterday. So we actually having a very huge burden of disease, but at the same time, we're losing quite a lot of people, and unfortunately, that should not be the case because this is a curable disease, and we shouldn't be losing people. But when it comes to the Free State, this is the situation. We have a total number of 8,216, of which out of the 270,000 nationally. And our treatments, while we experience 12.3% loss of life, and also we lose about 11 people, 11.3%, who are people who just, abandon treatment. And these are the people and our clients that we want to really trace and talk to. And of course, Mangaung Metro, because it has a bigger number of residents, is the one that has a higher caseload in relation to this matter.
So, in terms of prevention, diagnosis, as well as treatment, as they are the backbone of the TB control, what's the Free State Department of Health doing to fight TB, especially when it comes to stopping it as well as preventing it from affecting us?
Can you repeat the question again?
I was asking if what the Free State Department of Health is doing to fight TB, especially when it comes to stopping it before it starts, finding it early, and making sure that people get better.
Thank you very much, and apologies for making you to repeat the question. Yes, you're right. Prevention, diagnosis, and treatment are the backbone of TB control. The province has likely has programs like mobile clinics. We have awareness drives. We used to have partners that we're working with. Some of them are not able to proceed with their work now, but we have quite a number of events and activities that we are using to firstly prevent and diagnose and also treat those that are affected. But some of our key responses relates to the following: that we advocating for health education in terms of what TB is, what are its prevention, and how to deal with it. We also utilizing our community healthcare workers to do screening of clients in the different households. For an example, out of the speech by the Deputy President yesterday, it was clear that one client with TB has a potential of infecting 15 others, and we really need to cut that number down. So our community healthcare workers and our outreach programs does the work of screening those who have been in contact. And all our clients and patients are linked to certain facilities so that they can then be monitored, so that we are able to make sure that the disease is dealt with. And yes, we really want to end it.
So, speaking of the Deputy Minister, Paul Mashatile, did mention that this year, a theme for World TB Day is yes, you and I can end TB, commit, invest, and deliver. How are you getting the Free State communities as well as businesses, including churches, involved in this drive?
We are empowering the existing partners, which constitute traditional practitioners. We engaging partners like churches, like businesses, including those that historically have employed bigger number of people. That includes the mining, the mines, and other, labor-intensive, sectors of our economy, agriculture and others. We working with the community NGOs and other government departments, and this takes place through community engagement, outreach campaigns, and we do our best to always educate our clients about TB and what is it that can be done to manage it. And let me also indicate that in our primary healthcare facilities, every morning there is a period for health education, and all our clients who visit our healthcare facilities at the primary healthcare level, which is like clinics, every morning they are given, they are empowered about what TB is and other diseases that are a burden to our health.
So speaking of diseases that are a burden, I believe HIV and TB often go hand in hand. And the Deputy President did mention that they want to tackle them together. So as the Free State, how are we blending these services and the impact? How has it been so far?
In the Free State, all health facilities, in fact, let me say majority of health facilities are providing both HIV and TB services. The Free State screen all clients that are HIV positive for TB and also test TB clients for HIV. So we provide TB preventative treatment for HIV positive patients as well. So what we're doing is that we want to create something like a one-stop where all our clients can then come in and get this kind of assistance. And remember, we still have to push back the frontiers of stigmatization and the issues that relate to our clients, backsliding in terms of treatment due to fear of what people will say if I'm seen going to a particular health facility.
So there's an campaign that was launched last month that ties into TB because of co-infection risks. It also finds out that the province target and the tactics, maybe door-to-door campaigns or radio ads to link it back to TB efforts. So now the Close the Gap campaign, hunting for 1.1 million people, as well as HIV status that aren't on treatment. Want us to get into the Free State's role in this commission?
Thank you very much for that question. We're working very hard to ensure that our facilities are able to trace the number that is allocated to the Free State in order for us to meet the target. In fact, what I have indicated is that we need to go way beyond the target that we have been given. Our actual target should be 100% of the people that have been diagnosed. So in as much as we are allocated 22,631 as the contribution of the Free State toward the 1.1 million, the reality is that we have more than 22,000 who have been diagnosed, and all of them have to be on treatment. Otherwise, if not, they will not be able to eradicate this disease from our, from the province at large. So as the campaign is intended to close the treatment gap for both HIV and TB cascades. And the gap that we currently experience is about 80% of HIV treatment gap, but will be tested for TB, and which is about 18,103. So for TB, that's what we intend to do, and we'll be able to also close the gap, be able to provide, healthcare for all our people, but most importantly, prevent the spread of the disease. So our view is that we are going to be able to deal with this matter. And as we were trying to deal with the figures, we have been given 22,631 as a province. We have 214 clinics in the province, which means every clinic just needs to go out and trace 8 clients. And that's something that's very workable. And my view is that let's go and trace more than that. Even if each clinic goes and traces 10, then we know that we way beyond 30,000, and we can then close the gap completely to 100%, not, over the percentage that we have been set, which is 95%.
All right. Just to save time, thank you so much for joining us, Minister. Any last words from your side?
From my side, I would like to make a call to our communities to make sure that we encourage our people to go out and be screened for TB and be screened for HIV, so that we're able to protect our loved ones against these diseases, so that we are able to have the free staters living long and healthy lives. So we would really pledge to for the support of our communities in our battle for healthcare, but also making a call that can we do what we can to reduce and even eradicate the incidences of gender-based violence in our homes and in our communities. And then lastly, can we please protect public property? Our clinics and facilities are being vandalized on a daily basis, and we call upon our communities to stand up and protect our facilities. Thank you very much.
All right. Thank you so much, Minister. Enjoy the rest of your day.
I will. Please do the same.
All right, thank you. That was MEC Monyatso Mahlatsi from the Department of Health. That is how we close it off on episode 74 of Current Review. My name is Angel Tekiso, and see you next week, same time, same